Hi, my name is Dr. Larry Kosiolik. I'm one of the pediatric infectious diseases physicians here at Lurie Children's and the medical director of infection prevention and control. I lead the COVID-19 response efforts here at Lurie. And throughout the last year and a half, we've learned a tremendous amount about how to keep our workforce, our patients, and our families safe. One very important topic that has raised interest of a lot of people is the impact of COVID-19 in pregnant women, their babies, and in women who are breastfeeding. This has recently led to CDC providing new updates that vaccine is now recommended in women of childbearing age. If you're planning to become pregnant, currently pregnant, or recently had a baby and still breastfeeding. This has led to us changing our vaccine mandates here for workforce to include these patient populations. To provide more education on this topic, we've convened a panel of 3 experts here at Northwestern and Lurie Children's who are here to talk about COVID-19 in pregnant women, women who plan to become pregnant, and women who are breastfeeding. And I'll introduce them here. So first, we have Dr. Emily Miller, who is an assistant professor of obstetrics and gynecology in the Division of Maternal Fetal Medicine at Northwestern and an attending physician at Prentice Women's Hospital. Dr. Miller is a local and national leader in obstetric care during the pandemic, and she's led hospital operations as the chief of obstetrics. She served on Professional Society COVID-19 Task Force and done a tremendous amount of teaching to both patients and healthcare workers alike. She's developed guidelines and performed research in this area, and we're very pleased to have her today. Dr. Lena Mithel is an assistant professor of pediatrics at Northwestern University and a pediatric ID physician scientist here at Lurie Children's. She has tremendous clinical expertise in congenital and neonatal infections. Her research is focused on COVID-19 in pregnant women, the immune response, and the health outcomes in those infants. During this pandemic, she's been involved in developing perinatal guidelines at Prentice and has done a lot of research on SARS-CoV-2 infection and COVID vaccines in pregnancy. Dr. Jennifer Howe is dual certified in internal medicine and pediatrics, so has a unique skill set taking care of both patient populations. She's an associate professor at Northwestern University in the Department of Pediatric and Adult Infectious Diseases, and her research focus is on infections in the context of maternal fetal health. She also, like our 2 other experts, has done a tremendous amount of clinical care and research of COVID-19 in women during pregnancy. My first question is for Dr. Miller. You provide care to pregnant women at Prentice Women's Hospital. Can you tell us a little bit more about what you're seeing in terms of COVID-19, in terms of risks and severity in pregnant women?
Absolutely. So I think it's important to reiterate that most pregnant people who acquire the SARS-CoV-2 virus do not get critically ill. Most will be asymptomatic or have mild illness, and that's very important. However, we know that pregnancy is a risk factor for severe morbidity and mortality. Specifically, when we compare reproductive aged women who are not pregnant to pregnant people, we see that pregnant people are more likely to need to be hospitalized, need to be admitted to the intensive care unit, need to be intubated, need to be on things like ECMO, and they have a higher risk of death. I can tell you since the Delta variant has come into play, we're seeing this palpably on the ground. I can tell you that our uptick in admissions to the hospital and ICU admissions is really present. And I can also tell you unequivocally that at Prentice specifically, it's only unvaccinated pregnant people that are getting admitted to the ICU so far.
So that's really, really important. So it seems that COVID-19 is not only causing more severe disease in pregnant women, but the vaccine is showing effectiveness in pregnant women as well.
Absolutely.
So my next question is for Dr. Mithel, and one of the more complicated issues of pregnancy is that you're taking care of 2 patients. There's the mom and the baby. And so can you tell us more about the risk of COVID-19 to the unborn babies of pregnant women who become ill with COVID-19?
Absolutely. So as Dr. Miller said, pregnant people are at risk of having severe COVID-19. And that's not just a risk to the pregnant woman, but it's a risk to the pregnancy as well and the health of the unborn baby, the developing baby. And so we know that there's an increased risk for the pregnancy in terms of complications such as preterm birth, so the baby being born earlier than full term. And there may be other signals of complications, including, preeclampsia or maybe even pregnancy loss. So some of the data is still evolving, but we're concerned that there are, implications for the pregnancy and the health of the baby as well. We also have done some research showing that there are differences and abnormalities in the placentas of a subset of women that have had COVID-19 during pregnancy that are not present in women that did not have COVID-19 and that are not present in pregnant women that received vaccine during pregnancy. So that's another signal that there may be something going on that's related to the placenta in a subset of women that have COVID during pregnancy. I think the long-term outcomes of babies born to women that have COVID-19 are still, being studied. I think, again, most babies born to women that have COVID do well, have been seeming to do well in the short term, but I think there are still significant risks.
Got it. Thank you for that. Dr. Howe, we'll move on to you. So what is the current science regarding safety and effectiveness of COVID-19 in pregnant women and the risk and benefits of vaccine for their babies? And how do you think this has influenced the CDC, the American College of Obstetricians and Gynecologists guidance in terms of recommending vaccine for pregnant women?
Yeah, I think that's a great question. We're at a pivotal point now, I think. We didn't have data like this a year ago. And I think up until February, we were kind of limited to small studies, about 120, 130, one out of New York City, where they were looking at how much antibody response a woman could mount after she got her vaccine. And what we found, and even in these small studies, is that after a woman who's pregnant gets her vaccine, about 5 days later, she will mount an antibody response. And about 16 days later, you can see transplacental transfer of those antibodies. They also did another small study that I believe was published in Journal of Obstetrics and Gynecology, and they were able to show that antibody responses after a vaccine in pregnant women were no different or no worse than in non-pregnant women. And lactating women had pretty good antibody responses too. But I think what's really wonderful right now is that we have gotten our hands on the CDC's data that they've made known to the public and published through their recent journal article in the New England Journal of Medicine, where they took their V-Safe post-COVID vaccination registry. And just so that folks know what that is, all of us who have gotten our vaccine can voluntarily sign up for these little trackers on our cell phones. And it asks you every day, what kind of symptoms you're having after you've had your vaccine. So I believe right now, as of July, there's about 136,500 who've put their names voluntarily into this registry. And of those, as of February, there were about 3,900 women who said they were pregnant and would additionally enroll into the V-Safe pregnancy registry. And so with that number, 3,900 and so pregnant women in the pregnancy registry who got COVID vaccines, there was a New England Journal of Medicine article published recently that showed really no huge signals for concern, no increased rates of stillbirth or preterm birth or any of the worries that we have when we're moms carrying newborn babies, because they compared the incidence rates of these things with the background incidence in just a normal population. And, that registry, the CDC V-Safe pregnancy registry, is growing. And even as of this past month in July, there's now 5,100 women. So I think there's more and more data coming forth. And so we finally have some numbers to make us feel comfortable with the current recommendations, which are that women of reproductive age who want to conceive or are pregnant should get the vaccine.
Great. So it sounds like we should be quite confident in the safety and effectiveness, and that'll only grow with time.
Yep.
That's great. Thank you. Dr. Mithil, Dr. Howe mentioned lactating women as well. And so there's a lot of women that had been pregnant that are now have their babies and are breastfeeding. Can you comment a little bit about risks and perhaps even potential benefits of vaccine for breastfeeding women and their babies?
Absolutely. So the COVID-19 mRNA vaccines and the non-mRNA vaccines, the J&J and AstraZeneca vaccines, they don't cause infection in the recipient. And so there's no risk of transmitting COVID or the SARS-CoV-2 virus through breastfeeding to the baby. On the flip side, we know that breastfeeding women, lactating women, women that were recently pregnant have good immune responses, and that some of those antibodies against SARS-CoV-2, so antibodies against COVID-19, are found in the breast milk and can be transmitted to the baby. And, that is sort of a bonus in that perhaps that it, affords some protection to the baby. The details of exactly how much protection and how that breastfeeding from a vaccinated mom affects the baby, we don't really know in terms of the level of protection, but we're continuing to study that.
Great, thank you so much. Dr. Miller, there's a lot of concerns about fertility, a lot of misinformation. I was hoping, can you comment about risk and benefits of vaccine as it relates to fertility, not only generally to women, but also women who may be undergoing fertility treatments?
Yeah, it's such an important question. This myth comes up and really has prevented a lot of people who need the vaccine from getting the vaccine. So I'm glad we have the opportunity to dispel some of the myths. The concern that had been raised is that there's some sequence homology. The genetic code in the mRNA vaccine overlaps with that of a protein in the placenta called syncytin. And the thought was, gosh, if these antibodies are produced to attack the placenta, that's going to prevent a person from becoming pregnant. The good news is we now have a fair amount of data to refute that and really to prove to us all that this is a myth. The first is that basic science, that homology doesn't mean that the protein that's formed, that spike protein antibody, really doesn't have enough similarity with what's in the placenta to say that it's going to clinically make any impact when we look at it translationally. In addition, there's two really important pieces of clinical data that have come out that corroborate what we thought scientifically. One is the data that Dr. Howe presented, right, of 2,500 pregnant people who had made it to 20 weeks, when most miscarriages will happen by that point. We don't see any increased risk in miscarriage. If this vaccine was attacking a placenta, then goodness, we would expect to see a higher incidence of miscarriage if we thought there was going to be an impact on fertility as well. In addition, in those undergoing fertility treatments, we've seen no change in oocyte or egg quality or quantity in those that have gotten vaccinated compared to those who haven't. We actually see no differences in semen analysis for men who have gotten vaccinated or not vaccinated. And then finally, some fertility data of folks who have gone through the IVF cycle. We don't see any difference in achieving a pregnancy after IVF in those with or without vaccination. So I think at this point, we can concretely put that in the box of this is a myth. There are no clinical impacts in terms of fertility of the COVID-19 vaccine.
Great, that's excellent news. So it sounds like if that cross-reactivity were to occur with the vaccine, we would have also expected it to occur with natural infection.
Right.
And that's not something being seen either. And so it sounds like we have a lot of information to refute that piece of misinformation. So
You're
thank you
absolutely
for that.
right.
So thank you. So Dr. Howe, our last question. So at Lurie Children's, our vaccine policy allows all individuals to request a medical exemption. Can you comment about any pregnancy-specific conditions or other women's health-related issues that women may want to consider talking to their physicians about in terms of exemptions?
Yeah, there's no really additional exemptions that a pregnant woman might want to consider that are different from what you would normally consider an exemption in the general population. So, the usual things that you would consider if you weren't pregnant is if you had an allergic reaction or anaphylactic reaction to other components that are in the COVID vaccine, such as polysorbate or polyethylene glycol.
Great. Well, thank you for that. So I'll just close with one final question for each of you. And is there anything additional that you think women should be considering, and especially as you, not only as a physician, but as a spouse, a parent, when you have other people in your lives that are relying on this information, any additional information you would be providing as advice to those around you? Dr. Miller?
Yeah, I can get started. I think I'm an obstetrician, and most of pregnancies are positive and upbeat and exciting times in people's lives. I'm in maternal fetal medicine, so I certainly have encountered a fair share of complications. And what we're seeing in the conversations we have to have during critical illness with COVID-19 are heartbreaking conversations about, do we want to risk a mom's life to be able to try to resuscitate an infant? And I think the most heartbreaking piece of these conversations is that they're completely avoidable. That if these individuals had been vaccinated, we probably wouldn't be in this scenario. I can also tell you every pregnant person that I have cared for in the ICU or that's needed oxygen supplementation who hasn't gotten the vaccine leaves the hospital and gets the vaccine and tells their entire community members, please get this, don't go through what I got through. So as much as I can amplify their voices and say, don't be on the post-hospitalization end of vaccination, do it before this becomes so acute.
Oh, thank you for that. Dr. Mithal.
Yeah, as a pregnant person, as a future mother, as a mother, you want to do the best to optimize the health of your unborn infant and baby. And, there's evolving data, and we will continue to have more data on safety. And it's early, but we have a growing body of data that there's no signal that the pregnancy or the unborn infant is being harmed by getting vaccine during pregnancy. And on the flip side, especially with rates of COVID increasing, it is becoming harder and harder to protect yourself and the pregnancy and the unborn baby from COVID-19. If that happens, I feel like that is a real risk to yourself and the baby. And so I think weighing these two things are difficult, but it's becoming less and less difficult. And from a provider standpoint, I would recommend, getting the vaccine to optimize the likelihood of a healthy pregnancy and a healthy baby.
Great. Thank you for that advice. Dr. Howe.
Yeah, I would just say from personal experience, just 2 weeks ago, having tested positive myself for COVID, when I juxtapose my very mild illness because I was vaccinated against 2 pregnant women who were unvaccinated and ventilated and having a very difficult time in a very complicated course. It's been very sobering for me to see the 2 cases juxtaposed. And as a mother myself, if I were pregnant, I would wholeheartedly get the vaccine and be confident that if I still got COVID, I would be safer, and so would my unborn child. I think it is a personal decision. I get it that it's a real struggle, and I don't want anyone out there to feel as though they're struggling in isolation. So please, please, please reach out to your provider, your medical providers, and have that dialogue rather than struggle in isolation.
Great. Thank you. Well, I just want to thank the 3 of you for not only joining me today, but for everything you've done for our academic mission for COVID-19, for advancing women's health and being leaders in the field. So thank you.